Well, the BC government is promising that by 2015, everyone will have access to a family doctor. The province is spending $132 million on its new plan to address the chronic shortage of family doctors, and that includes paying doctors to do phone consultations and incentives to take on more patients who have complex needs. And it will also let physicians and health authorities work together to improve access to care. Joining us now is Dr. Shelley Ross. She is the president of the BC Medical Association. Good afternoon to you.
Good afternoon.
Thank you for being here. Access to a family doctor for everyone by 2015, it sounds, well, is that really possible?
Since 2010, we've been prototyping this initiative in White Rock, Prince George, and the Cowichan Valley, and certainly we've seen great results. We've found a family doctor for 9,000 patients during that time.
How far does it go, though, in addressing, I mean, you have called this a crisis when it comes to a lack of family physicians in this province. How far does it go to closing that gap?
It's certainly a good step along the way. We know it's good for patients because we're putting in supports in doctors' offices so they've got the capacity to take on more patients.
And what does that mean when you say supports in doctors' offices?
It's going to mean different things in different communities. We have in communities divisions of family practice, and they are going to be getting $40 million to figure out and implement what is the best way to attach patients to doctors in their community. It may be hiring more doctors. It may be using other health professionals. It's what's going to work best for them.
And is this a problem that we see mostly in rural areas of the province? Because I think in the Lower Mainland, with the concentration of doctors and hospitals we have here, it might not be so difficult. Am I wrong in that assumption?
You're wrong.
Oh.
When I left my practice to become the president of the BCMA, I worked in Burnaby. I had to walk away from 2,700 patients.
Really?
Yes.
And simply because you couldn't find anyone to replace you?
Nobody wanted to take on a practice.
Why are we at the point where it is so challenging for people to find a family doctor?
There's not enough family doctors, for sure. So what we're doing with this program is trying to improve how effectively doctors work. We're trying to give them some help so that they can take more patients. We've got some fees for them to take on the really difficult, time-consuming patients. But it's also important that they're going to work with their community associations of doctors, their divisions of family practice, and figure out how are we going to get more patients with a family doctor.
So we have seen doctors, family doctors, cherry pick, and our own, we have a doctor we speak with every week, Dr. Brian Goldman. He talks about family doctors cherry picking the patients that are going to be the least amount of trouble. Do you see this ending that practice?
This is certainly going to help because, say, for example, if you're seeing a complex patient that takes the equivalent amount of time when somebody who's seeing an easier patient could see 3 or 4 patients, this is going to help doctors be compensated for that time that it takes to figure out those complex problems.
Family doctors, though, are already fairly pressed for time. I mean, you get there and they have several patients on the go at once, and you're lucky to get a few minutes with your family doctor. What is this going to do to the kind of care people get from their family doctor?
It's going to allow them to schedule the adequate time that's needed to look after these complex patients.
Does this do anything to increase the number of family physicians in the province?
Depending on the division of family practice, if I can take the example of White Rock, what they did with their money was to hire 7 physicians so that, for example, patients coming out of hospital that didn't have a doctor, they had a place to go in this primary care clinic.
Right. And so when it comes to the training and recruiting doctors, getting doctors into place in family practices, what does this plan do?
This plan gives them incentives to look after complex patients. There's incentives to take on new patients. Part of the plan as well, which is just a little bit distinct, is to do in-hospital work. But certainly one concern we've got with the budget that came out this week, we know that if we're going to have programs that increase your access to a family doctor, that means there's going to be more services provided. Also, we've got an aging population and we've got a growing population, and we need to make sure that the government puts enough money into the MSP budget, which is the budget that pays doctors. Because if you get all these good programs and there's no money to provide the services, we're just wasting our time.
And even if there is money to provide the services, I mean, you're offering financial incentives to encourage doctors to take on more patients, more complex patients. How many doctors in BC are actually in a position or have the capacity to be able to do that at this stage?
And this is what this initiative is all about, is increasing capacity so that they will have room to take on other patients. Because we're going to make the practice of medicine more effective so you're not wasting time doing things that you don't need to do as a doctor.
How is all of this going to be monitored? How will we know whether any of this is working?
We will certainly be monitoring it very carefully, and it also is going to improve the relationship between the patient and the family doctor, because we know that if you have a family doctor, that your health is going to be better. It's going to keep you out of the emergency room, it's going to keep you out of the walk-in clinic, and it's going to be saving money for the system as well.
And what about this idea of telephone consultations? How much can a doctor really do over the telephone?
It's not going to be a new consultation. It's going to be follow-ups. For example, if you're diabetic and you'd normally come in after 3 months or 6 months to see what your blood sugar's doing, you can be monitoring at home. A quick phone call from the doctor can say, yes, you're on track. I want you to continue doing this. Or say, oh, I think we need to fix things a little bit. So it will save time, and also for the patient who's elderly and finds it difficult to come in, it's going to be a big advantage for them.
Dr. Ross, very good to hear from you this afternoon. Thank you for making time with us.
My pleasure.